This is my second vlog on skills versus capacity. Skill is the rhythm and technique of the task being performed and can often appear to be a capacity issue. These can usually be corrected via good coaching and practice. A capacity issue is a physical limitation through tissue quality or quantity. For the speed part of this vlog, we will focus on acceleration itself. Acceleration is defined as the rate of change in velocity and relates to Newton's second law of motion. Athlete number 1 is presenting multiple skill issues. Initial observations are the movement in the torso. The forward lean exists, but pops up very early. This is limiting the amount of horizontal force that can be produced. There is also poor thoracic extension. The athlete is attempting to compensate and get lower. Further, there is a lot of rotation of the torso, and the torso position is suboptimal. This leads to a poor line of resultant force. There appears to be a lot of movement from the hip left and right, creating an energy leak in the kinetic chain. The arm swing is across the body, resulting in poor force transmission. There's lots of wasted kicking out the back. Ground contact appears to be in front of the center of mass, therefore increasing braking forces. The heel recovery is high, increasing time off the ground. A low heel recovery would allow him to get his foot down to the ground and quickly produce more force. The front allows us to see rotation of the torso more clearly. We can also see the extent of the arm swing across the body. Athlete is displaying long ground contacts with version of the foot, but seems to maintain good dorsiflexion of the ankle. I believe the main issue throughout this phase is the backside mechanics. Overkicking out the back is causing this athlete to extend the hip, knee and ankle for too long, leading to a poor rotated torso and hip position. The arms then follow the same pattern. Posture is often referred to as the most important aspect of speed. Movements of the limbs originate from the core of the body. Proper stabilization and alignment of the core ensures appropriate movement of the limbs. To improve this kicking out the back, we can use specific drills to increase and focus the athlete's ability to claw the floor back, thus decreasing the kick out the back so much. Athlete is being cued to stay tall and claw the ground behind him. The constraints of this exercise enable the athlete to focus on his weakness. The capacity is there, but the skill is underdeveloped. The interventions for this athlete include good coaching cues, such as pawing back the ground, and task constraints, focusing on the specific part of the skill that is causing issues, in particular, utilization of a B-skip. Improving this will enable the athlete to spend more time propelling the body forward, reduce ground contact time, and improve force transmission, postural position, stability, and alignment. Athlete number 2 possesses multiple capacity restrictions. Initial observations of this athlete are that he seems to pop up high within 2 steps, similar to that of the previous athlete. The torso appears to be extremely rigid, but in a flex position before pulling upright. Triple extension is not realized. There is a lot of flexion and extension going on at the arm. He seems to demonstrate limited dorsiflexion at the ankle, causing pronation. And finally, he seems to have a high heel recovery, wasting time off the ground. From the front, we can see a lot of the same things. He's still rigid through the torso. The arm movement is more pronounced. We can see there is an energy leak at the hip with a lot of movement from left to right. His stance appears quite narrow with the knee crossing over the midline of the body, reducing his base of support and potential for force. And finally, the pronation is causing significant eversion at the foot, possibly caused by restricted ankle dorsiflexion. The capacity issue I am going to focus on is this athlete's excessive pronation and subsequent eversion at the foot. We can see the athlete begins to avert the foot before taking his first step. Pronation of the foot causes eversion in the subtalar. This can be caused by a weakness in abduction, tight hip flexion musculature, or restricted ankle dorsiflexion, or a combination of all three. The frontal view shows his excessive pronation to an even greater extent during the stance phase. We can also see his lack of dorsiflexion in the swing and the knee crossing the body at the top. A knee valgus position can be seen in the swing, possibly due to the subtalar eversion in the stance phase prior. This is causing medial rotation of the femur and a possible anterior tilt of the ilium. This is highly inefficient when it comes to force transfer and opens the athlete up to multiple injuries. To ensure this is a true reflection, I asked the athlete to perform an A-skip. The A-skip allows us to further see the pronation, eversion, and restricted ankle dorsiflexion. To assess hip function, athlete performed a single leg squat. There are clear balance and mobility issues here. However, his abductor strength
seems to be pretty good, with the knee maintaining a fairly good alignment on the descent.
However, there does appear to be some eversion going on at the ankle.
To assess the ankle complex, and more specifically ankle dorsiflexion, athlete is performing a knee to wall. From the side, the athlete looks okay, achieving 11 centimeters. Research tells us that we should be looking for no less than 10 centimeters without compensations. However, from behind, we can see severe compensations through eversion of the ankle.
For the interventions, first we need to assess whether it was soft tissue or joint based. Assuming it's soft tissue and we can actually make a change, we can increase range of movement via stretching, myofascial release, manual therapy, and eccentrics. For agility, one of the most recent definitions is by Shepherd and Young 2006, a rapid whole body movement with change of velocity or direction in response to a stimulus. For this component, this vlog will focus on change of direction without an external stimulus, using the Pro Agility test, commonly seen in the NFL Combine. Athlete number 1 in this task is the same, and is once again displaying multiple skill issues. Major issues with this athlete are in the turns. Poor foot placement, too close to the center of mass, is creating a poor base of support, making the crossover step harder due to the hips being closed to the direction of travel. This is also causing poor postural alignment and therefore line of force, reducing the lateral and horizontal force being produced. This further causes eversion of the foot out of the turn, creating a longer ground contact time. This athlete seems to be much better off his right than his left, demonstrating a much better foot placement outside the center of mass, correcting some of the previous issues and opening the hips towards the direction of travel. However, the hips are still high, resulting in a less optimal position for creating force. The hips are more open to the direction of travel, creating a better foot placement out of the turn. More practice and coaching are required to improve his athlete's performance in this aspect. Athlete needs to be encouraged to place his foot outside of the center of mass, drop his hips and keep his chest up, then punch the knees into the direction of travel. This would also open the hips up to the intended direction and reduce the eversion at the foot, shorten the ground contact time, and waste less time in the long run.
Following these cues and some practice, athlete is looking significantly improved on both sides. Athlete's outside leg is further outside the center of mass. The inside leg is taking more of the weight and is more open to the direction of travel. Athlete is showing a much improved torso position. This is creating a much more efficient line of force. And finally, the angles are much more acute post-intervention.
These interventions should lead to a reduced time dependence of the turn, resulting in a quicker, more efficient change of direction. Athlete number 2 is once again displaying capacity issues in this task. Athlete starts without great intent and is decelerating within 2 steps. Into the turn, the athlete still has a high center of mass with suboptimal posture. The foot is too close to the center of mass, leading to a poor line of resultant force. If the foot was to be placed further outside the center of mass, it would create a wider base of support, improving stability. Hips are very closed to the desired direction of travel, forcing the athlete to adjust the foot position and able to push off, slowing him down. Athlete needs to load the inside leg more in order to drive into the other direction. In the second turn, athlete's center of mass is still high, and the torso position is still suboptimal. The athlete is getting slightly lower than the first turn, however the hips are still very closed to the desired direction of travel. The base of support is still narrow with a poor line of force. This closed hip position and the small base of support is forcing the athlete to take an additional step before crossing over. This also leads to a lot of eversion in the first step out of the turn, increasing ground contact and increasing the amount of time it takes the athlete to complete the exercise. Looking at this athlete's angles in the turns, we can see that they are quite large and would result in the athlete producing more vertical force than is desirable, slowing this athlete down. I believe the tightness to be around the hip. Therefore, I have asked this athlete to perform a Thomas test. As he pulls his knee towards his chest, there is movement in the opposite limb on both sides. This suggests a tight hip flexor. Further, the athlete is unable to achieve a 90-degree angle in his opposite knee, suggesting he may also have tightness in his IT band. Interventions will focus primarily on range of motion at the hip to allow him to achieve a lower position in the cut. This will enable him to get his center of mass lower while maintaining a more optimal torso position and produce more lateral and horizontal force out of the turn. Thank you for listening to my second vlog.